Bismillahirrahmanirrahim. Today, the topic of my presentation is scenario-based discussion of research ethics. Make each day your masterpiece. Learning outlines. Uh, Research ethics and cases involved in violation of research ethics. Learning outcome. At the end of this presentation, participants will be able to describe about the cases of ethical violations in studies and how to avoid these in research processes. Introduction. Research ethics is a codification of scientific morality in practice, norms that regulate the research community, integrity, accountability, impartiality, criticism, etc. The relationship to people who take part in the research, respect human dignity, confidentiality, freedom and informed consent, etc. Case number one. Hepatitis E is a relatively uncommon form of hepatitis that is usually transmitted by exposure to the blood of a person with conditions like hepatitis B and C. Hepatitis E is not tested for in blood donation. There is reason to be concerned that military personnel at the time of war, when injuries requiring transfusions are being suffered daily, that hepatitis could result in substantial long-term morbidity or illness. A vaccine was recently developed for hepatitis E that required testing. When it was mentioned at an international military training program that this new vaccine was imminent and a clinical trial needed to be done, a senior officer in the Nepalese army volunteered the entire army in exchange for a donation of military supplies. The US Army was delighted to follow up on this, keeping in view of research ethics which principle is violated in this case. Informed consent and education. As a researcher, we are bound by the rules of ethics. For example, we usually cannot collect data from minors without parental or guardian permissions. All research participants must give their permission to be part of the study, and they must be given pertinent information to make an informed consent to participate. This means you have provided your research participants with everything they need to know about the study to make an informed decision about participating in your research. Researchers must obtain a subject's and parents, if the subject is a minor, permission before interacting with the subject or if the subject is the focus of the study. Generally, this permission is given in writing. However, there are cases where the research participants' completion of a task, such as survey, constitutes giving informed consent. Research participants have the right to refuse to participate without penalty if they wish. Each university that receives federal fund, and most do, must have institutional review board that reviews all research conducted at the university. Case number two. Jones is a highly successful entrepreneurial academic scientist. His research team performs brilliantly conceived studies with precision and completeness. His lab has made many important contributions and he is consistently very well funded. A graduate student is considering John's lab for his PhD and speaks to the current trainees. They said that John's is merciless, requiring 15 hours a day for months before the annual meeting abstract due date. And he assigns projects without regard to the trainees' interest. Has trainees compete with each other unilaterally, determines authorship and first authorship in what appears to be an arbitrarily manner, and deals with the staff and trainees in a paternalistic and demeaning manner. He personally spends little time with his trainees and shows little interest in their families. uh, Keeping in view the research ethics, which ethic is strictly followed by Jones in this case scenario?
Autonomy.
Research integrity and intellectual honesty. Research integrity may be defined as active adherence to the ethical principles and professional standards essential for the responsible practice of research. By active adherence, we mean adoption of the principles and practices as a personal credo, not simply accepting them as imposition by rule makers. Intellectual honesty is an applied method of problem solving characterized by an unbiased, honest attitude, which can be demonstrated in a number of different ways, including but not limited to one's personal beliefs do not interfere with the pursuit of truth. Relevant facts and information are not purposefully hidden. Case number three. In an American institution, approximately 15 people are involved in performing a study on gastric lavage. Patients are informed about the study purpose and design. After the combined effort of all these peer and thorough conduct study was complete for publication. One person who is the most senior and influential among those make the study published in the journal having impact factor W as the main author of that study, keeping in mind the ethical principles of research process. Which ethical principle is violated in this case? Ethical principle of authorship. Claiming authorship is an explicit way of accepting responsibility and attributing credit for intellectual work that is published. However, incidents of inappropriately attributing authorship are not uncommon. Specific issues have emerged that cause concern, including unacknowledged authorship by industry writers, that is, ghost authorship, and the authorship credit to those who did not contribute to the research, gift authorship to those with name recognition to enhance the likelihood of publication, guest authorship, and assigning a level of authorship to someone who did not contribute to the project. In 2009, in response to such practices, the International Committee of Medical Journals developed three criteria for a person to be included as an author. First is substantial contribution to a conception and design, acquisition of data or analyzing and interpretation of data. Second is drafting the article or revising it critically for important intellectual content. And number third is the final approval of the version to be published. In recognition of the fact that the integrity of the research process, publication process is fundamental to the integrity of the research enterprise as a whole. Case number 4. Researchers cloned and sequenced the gene for interleukin 1. They sent off a paper to Nurture, very excited about the great result. Their work was funded by Cistron Corporation. A faculty member associated with the Immunex had a reviewer on the paper that the above group claims held up the paper and used key information it contained to clone and sequence the same gene. Even though there never was a market for a product from this gene, Cistron is suing because of which violation? Confidentiality. Research confidentiality. It refers to a condition in which the researcher knows the identity of research subject but takes steps to protect that identity from being discovered by others. In such cases, maintaining confidentiality is a key measure to ensure the protection of private information. Individuals may be only be willing to share information for research purpose with an understanding that the information will remain protected from disclosure outside of the research setting or to the unauthorized person. Case number 5. Asthma is a serious chronic problem in pediatrics. New drug is being developed for asthma need to be tested in children. This study, an actual study, compared beclomethasone, that is an established therapy, with a new steroid that we will call Nestor and placebo. Subjects were recruited from ages 12 to 16 and were required to have had asthma for at least 6 months and to have used steroids in the last 30 days, signifying serious shortness of breath. The subjects were randomized to four groups and treated for 12 weeks. Subjects would use albuterol and other standard agent as needed. The main outcome measure was FEV1, a measure of ability to take deep breaths. The study showed that all of these steroid doses were statistically equal and better than placebo, where FEV1 deteriorated. 10% of the active treatment subjects and 44% of the placebo subjects had to discontinue the study because of the shortness of breath. The study was done in doctor's office using a commercial institutional review board. Ethical principle violated in this case is
Beneficence.
scientific validity and value. 7 ethical requirements for clinical research are scientific value, validity, fair subject selection, favorable risk benefit ratio, independent review, informed consent, and respect for enrolled subjects. Discuss the study with respect to each of these. The goal of clinical research is to develop generalized knowledge that improves human health or increases understanding of human biology. People who participate in clinical research make it possible to secure that knowledge. The path to finding out if a new drug or treatment is safe or effective, for example, is to test it on patient volunteer, but by placing some people at the risk of harm for good of others. Clinical research has the potential to exploit patient volunteers. The purpose of ethical guidelines is both to protect the patient volunteers and to preserve the integrity of science. A study should be designed in a way that will get an understandable answer to the valuable research questions. This includes considering whether the question researchers are asking is answerable, whether the research methods are valid and feasible, and whether the study designed with a clear scientific objective and using accepted principles, methods, and reliable practices. Invalid research is unethical because it is a waste of sources and exposes people to risk for no purpose. Consistent with the scientific purpose, people should be chosen in a way that minimizes risk and enhances benefit to individual and society. Groups and individuals who accept the risk and burden of research should be in a position to enjoy its benefit, and these who may benefit should share some of the risk and burdens. Specific group or individuals, for example, women or children, should not be excluded from the opportunity to participate in research without a good scientific reason or a particular susceptibility to risk. Case number 6. In 1984, a faculty member was up for a tenured position in a clinical department. He was a shoe in having already published over 100 papers in peer-reviewed journals, mostly as first author. As it turned out, one member of the promotion committee decided to review some of the papers and found out that a number of them used the same instead of different control groups. When doubts were expressed to the chair, when co-authors were called and they reported that they had never seen the papers and knew nothing about them. It was discovered that there were no notebooks and no animals had been ordered to do the studies. The miscreant broke down and confessed. Uh, which ethical principle is violated? Fabrication was done in this process. Fabrication is the construction and or addition of data, observation, or characterization that never occurred in the gathering of data or running of experiments. Fabrication can occur when filling out the rest of experiment runs. For example, it claims about the results need to be made on complete data sets as is normally assumed, where claims made based on incomplete or assumed result is a form of fabrication. Case number 7. Uh, there is now hope to find a cure for HIV someday, or at least to accomplish long-term remission of the virus absent antiretroviral treatment, ART. Timothy Brown, the Berlin patient, appears to have been completely cured of HIV. 6 years after a curative intervention, Brown has no detectable level of virus and no need for antiretroviral treatment. Patients undergoing a variety of other interventions in France, Boston, and Mississippi developed stable remission of the virus without taking antiretrovirals, typically until a final viral rebound. While continued ART nearly eliminates morbidity and markedly prolongs life for people living with HIV, ART is the treatment, not a cure. Under ART, the virus persists indefinitely in a latent reservoir in the patient's body. Upon ART interruption, it rebounds. And even under ART, some comorbidities, stigma, cost, and burdens continue to affect patient, and lifelong treatment cost prevents adequate coverage for up to 35 million people living in HIV. Keeping the principles of research ethics, which should be considered in this case. Risk and appropriate risk to benefit ratio. This should be considered because risk is defined as the probability of physical, psychological, social, or economic harm occurring as a result of participation in a research study. Both the probability and magnitude of possible harm in research, human research, may vary from minimal to considerable. The federal regulations define only minimal risk. Minimal risk exists where the probability and magnitude of harm or discomfort anticipating in the proposed research are not greater and in and of themselves than those ordinarily encountered in daily life or during the performance of routine physical or psychological examination or tests. Risk above this standard is more than minimal, moderate, maximal, and that imposes limitations on the conduct of research and increases the requirement for monitoring. It also requires more stringent approval process when studying children or otherwise vulnerable population. Benefit. It applies to the potential of the research treatment to ameliorate a condition or treat a disease. This can apply to an individual participant or to a population. In research, as in clinical medicine, results cannot be guaranteed, but as a consequence of prior weak benefit may appear to be a reasonable expectation. Since this is research, an advantage for the treatment groups cannot be presupposed. Since the risk has not been fully evaluated, a statement of individual benefit should be made cautiously, if at all. The investigator should always distinguish between research and treatment and never lure the patient into participating in hopes of remission or cure. A main role of IRB is to determine the risk versus benefit ratio for clinical studies. They must make sure that the physical risk is not disproportionate to the benefits. When the physical risk is minimal, they must determine that psychological and social risks such as stigma are not important. It is not ethical to conduct a study in which an individual or a group is labeled so as to be stigmatized or to be made less. Case number 8. One of the most famous cases of deductive closure involves a researcher's ethnographic research, which was turned into a book. The author's data came from a small remote community. The research participants were able to identify themselves and their neighbors in the book, even though their real names had not been used. Relationships in the community were strained because of what was written, and the members of the community felt betrayed and humiliated by the researcher. Which principle of the research ethics was not taken into consideration while having this research?
Confidentiality, informed consent.
Confidentiality. Deductive closure, also known as internal confidentiality, occurs when the traits of individuals or groups make them identifiable in research reports. For example, if a researcher studying teachers named the school district where the research occurred, someone with knowledge of the school district could likely identify individual teachers based on the traits such as age, gender, and the number of years with the school district. In order to prevent accidental or deductive closure, in some cases, researchers may feel it is necessary to avoid publication altogether or to omit certain aspects of their data or individual cases in order to protect patients' identities. This is more common, especially in cases where dramatic or extreme situations are described. Steps for maintaining confidentiality. First, issues of confidentiality are addressed at the time of data collection. At this point, researchers and sociologists make assurance of confidentiality, typically via consent from statements such as all identifying characteristics, such as occupation, city, ethnic backgrounds, and will be changed. Researchers typically present confidentiality agreements at the beginning of the data collection process. Second is the confidentiality is addressed during data cleaning. Researchers remove identifiers to create a clean data set. A clean data set does not contain information that identifies respondents, such as name or address. Such identifying information might be stored elsewhere in separate protected files. Uh, Case number 9. A small tribe in Africa, confined to a few villages, is found to have an unusually high frequency of terrible disease, which happens to be a fairly common cause of death in developed countries. A group of gene experts expects that genetic study of the tribe will reveal a single gene or fairly small combination of genes responsible for diseases. Finding that gene can lead to treatment plan for disease. Members of the tribe were approached by geneticians, but tribal people were having few concerns regarding study. One is that they are poor people and will not be able to afford treatment even afterwards. Another concern is that they will be stigmatized as people having tribal diseases. Another concern is about their mental health. Their concerns were dwarfed by unrelated problems and were asked to leave their traditional land of theirs because of the disease they are not capable of having it. Which research ethic is violated in this scenario? Inducement is done. Undue inducement occurs when a person makes a choice in circumstances in which external factors are likely to have an inappropriate influence on his or her decision making process. The choice made by the person is not entirely free because it is unduly influenced by these external factors. And coercion. Coercion occurs when an overt or implicit threat of harm is intentionally presented by one person to another in order to obtain compliance. For example, an investigator might tell a prospective subject that he or she will lose access to the needed health services if he or she does not participate in the research process. The claimant must show that they were induced by the representation to enter into the contract. Inducement will be presumed if the misrepresentation was of a nature likely to have played a part in the decision of a reasonable person to enter into a contract. Case number 9. From 1999 to 2006, more than 200,000 people in the US died from overdoses involving prescription opioids. Opioid addiction also has clinical and economic costs. Compared to matched control group, opioid abusers have higher frequency of the use of medical services. For example, emergency departments, outpatient visits, and inpatient stays with consequent excess healthcare costs. The problem of prescription opioid addiction is complex and that causes multifactorial. However, when physicians abandon responsible practices for prescribing opioids and other controlled substances, they prey upon individuals with addiction and risk contributing to their death. Medical ethics are violated and should be considered while keeping or having any research on a clinical trial. Medical ethics is defined as a system of moral principles that bring values and judgment to the practice of medicine. As a scholarly discipline, medical ethics encompasses a practical application in clinical setting. Historically, Western medical ethics may be traced to guidelines relating to the duty of physicians that were formulated in antiquity, such as Hippocratic Oath and early religious teachings. Medical doctors have an ethical duty to protect the patient's human rights and dignity in research as well as treatment. Most codes of medical ethics are also require respect for the patient's human right in publications. 10 most common issues which are frequently neglected when dealing with study proposals, which are mostly considered to be a breach of medical ethics in a way or other. These are any procedure or intervention conducted on a patient that is not performed in the accepted routine management of that disorder or which is unnecessary and or potentially harmful. Administration of a drug or medication that is not given in the normal management of a disorder or which is unnecessary, potentially harmful to its effects are unknown. Obtaining signed consent in an attempt to justify an ethical procedure or immoral methodology, exposure of the patient to an invasive clinical procedure or potentially harmful non-invasive procedures in the interest of the study, exposure of the patient to undue radiation, no matter how small the dose, for the purpose of study, analysis, comparison, etc. Attempting a new invasive human clinical procedure without prior successful animal studies and without institutional review approval. Testing new medications without prior successful animal studies, FDA approval, or well documented indication for prescription. Harvesting an organ or tissue from one person who does not have the capacity to give consent. Attempting paraclinical procedures deemed unnecessary by current documented studies. Attempting. Use of an inferior procedure when a better procedure is available and has been proven more effective, less invasive, or with less complications, etc., for the sake of comparison. These are the references, and thank you.
Okay, thank you very much, Dr. Isma. A very good presentation about different aspects of medical ethics as well as research ethics. However, I want a few things to be clear in this presentation. You have talked about very important things like fabrication, falsification, misconduct, coercion, and then inducements. How would you differentiate between fabrication and falsification and between coercion and inducement? Would you please like to elaborate upon it?
Uh, Madam, in coercion, the researchers mostly make a threat to the people who are involved in the study. And in inducements, there are not that much threat, but they force them to do that by, like in this scenario, they were asked that the researchers will take their land. And in fabrication and falsification, fabrication is the process in which researchers uh, fabricate research. They make things. They don't do study. They don't ask people. There are no control or any people involved in the study. Wherein falsification, the falsification.
Okay,
mm,
Dr. Isma, let me have certain important additions in your talk. That is, you have talked about coercion. Coercion is always hidden threat. It may not be very obvious. And certain groups, when they are being used for research, they are more having coercion rather than they have the overt threat. For example, when the prisoners are used or the students are used or there are certain age groups that are being used in research that are being registered in certain institution and they are under control of some authority, it is more coercion. While inducement is usually given different types of the things that will lure the study participants into the research and tempt them to be included in the research is inducement. So in coercion, there is a hidden threat, while in inducement, usually there are certain types of lucrative offers that are gifts that can be given to the research participants. Both are incorrect. Similarly, in fabrication, there is a cooked data. The data was not there, but it was made by the researcher and it is fabrication. However, in falsification, the data is there, but it is either being presented wrongly, there is a mispresentation of the data, or the conclusions that have been drawn from that data or the interpretation of the data that are not truthful or honest, and that lead to falsification. There is another very important thing that I want you to please elaborate about is the role of the authorities in decreasing research misconduct, in decreasing all this type of fabrication, falsification, coercion, inducement. You have talked about one, that is International Committee of Medical Journal Editors, but there are many others. Would you please like to elaborate on them, please?
मैडम मैं स्लाइड्स पे ऐड कर दूंगी अभी तो.
Okay, right. Thank you very much, Isma. There are other authorities like if there are clinical trials, we know that in Pakistan we have Drug Regulatory Authority of Pakistan that is responsible for effective drug regulation and clinical trials to ensure the safety, efficacy, quality, appropriateness of the information. And we also have COPE guidelines in Pakistan, where Committee of Publication Ethics that is looking for the cases of research misconduct. Similarly, we have Higher Education Commission of Pakistan and Pakistan Medical Council. Even they are very much concerned if there is any case of research misconduct, or if there is any fabrication, falsification, there is any coercion or inducement during research. So research, thank you very much, Dr. Isma. If anybody has any question, you are most welcome to ask. So if there are no questions to put up, we can stop here. Thank you very much, everyone. Allah Hafiz.